Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an oncologist discussing treatment options with a patient named Miss Sana. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Sana. It's nice to see you again. How are you holding up since the last time we met?
Good morning, Doctor. I'm feeling a bit nervous, to be honest. There's just so much to take in and I have so many questions. I've been trying to stay positive, but it's tough.
I understand completely, and I want you to know that you're not alone in this. We're here to support you every step of the way. So, let's go over everything in detail today, including any questions you might have. Does that sound good?
Yes, thank you. That would really help.
Great. So, based on your recent biopsy, we've confirmed that you have early-stage invasive ductal carcinoma. This is the most common type of breast cancer. And while it's always difficult news to hear, early-stage cancers often have very good outcomes with the right treatment. Let's discuss your options, starting with a bit of background if that's okay.
Yes, please. What exactly does early-stage invasive ductal carcinoma mean?
Certainly. Invasive ductal carcinoma, or IDC, means that the cancer began in the milk ducts but has started to invade nearby breast tissue. Being early stage, however, means it hasn't spread to other parts of the body, which is a positive sign. We're also in a position where treatment options are highly effective at this stage.
Okay, that's a bit reassuring. So, what are the options for treating this?
There are a few primary approaches we can consider. The first option involves surgery to remove the cancerous tissue. Many patients opt for a lumpectomy, which removes only the tumor and a small margin of surrounding tissue, while others choose a mastectomy, where one or both breasts are removed. Each approach has different benefits, so we can discuss these in depth based on your preferences and comfort level.
What would be the difference in outcomes between a lumpectomy and a mastectomy?
That's a great question. For early-stage IDC, both lumpectomy followed by radiation therapy and mastectomy generally have similar success rates in terms of preventing recurrence. With lumpectomy, radiation therapy is usually recommended to ensure that any residual cancer cells are targeted. A mastectomy can sometimes mean less follow-up treatment, but it's a more extensive surgery. We'd want to make this decision based on what feels right to you.
I see. I'm a bit worried about the idea of surgery, but I also want to be as thorough as possible. What other treatments might be involved?
That's very normal to feel that way. Beyond surgery, we would likely consider radiation therapy if you choose the lumpectomy. Additionally, because IDC can be hormone sensitive, we often use hormone therapy, especially if the cancer cells test positive for receptors like estrogen or progesterone. In some cases, chemotherapy is also recommended, but that depends on certain factors like tumor size and grade. We'll be conducting further tests to tailor the treatment specifically to your cancer.
And this hormone therapy, what does it involve?
Hormone therapy helps block hormones that can fuel the growth of breast cancer cells. For example, if your cancer is estrogen receptor positive, We would use medications to either reduce the estrogen levels in your body or block its action on the cancer cells. This therapy usually lasts for several years but has shown to be effective in preventing recurrence in many early-stage cases.
That sounds helpful. Are there side effects I should know about?
Yes, that's important to discuss. Hormone therapy can sometimes cause side effects like hot flashes, joint pain, and fatigue. However, many of these effects can be managed, and there are several options within hormone therapy, so we can adjust if any side effects become too disruptive.
I appreciate knowing that, Doctor. I just want to understand everything fully. And about chemotherapy, how do we decide if I need it?
Absolutely. Understanding is key. Chemotherapy is usually considered based on the tumor's specific characteristics, including size, grade, and whether it has certain proteins that may increase the likelihood of spread. Once we have the full results from your tumor profiling, we'll have a clearer picture of whether chemotherapy is necessary. If we do recommend it, we would discuss the duration and what you can expect from that course of treatment.
I'm so grateful you're explaining all of this, Doctor. It's a lot to think about, but it's reassuring to have a plan. Is there anything else we should be looking at now?
I'm glad to hear that it's helping. One other important aspect of early-stage breast cancer is genetic testing, especially for mutations in BRCA1 or BRCA2 genes. Knowing if you carry one of these mutations could help inform us on whether additional preventive steps might be beneficial, both for you and any family members. We can discuss whether genetic counseling and testing would be something you'd want to consider.
I didn't realize that could affect my treatment. I'd be interested in learning more about the testing and if it's necessary for my children too.
Yes, that's a valid consideration, and we'll provide support through the entire process if you choose to explore that. I'll refer you to a genetic counselor who can provide you with more details and guide you through the steps.
Thank you so much, Doctor. This helps me feel more prepared. Even if it's overwhelming, I feel like I know what I'm facing now, at least.
You're very welcome, Miss Sana. Please remember that we're in this together, and we'll make sure you're supported at every step. We'll schedule follow-ups to check in on your progress and adjust as needed. In the meantime, feel free to reach out with any questions or concerns.
Extract 2, questions 13 to 24. You hear a GP talking to a patient called Anna Bellamy. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, is this Anna Bellamy?
Yes, that's me.
Great. So, what brings you in today?
Well, I've been feeling quite unwell lately. It started with a bit of pain around my right side, near my ribs. I didn't think much of it at first, but then a rash appeared in that area, and it's been hurting a lot.
I see. I'm sorry to hear that. Can you tell me a little more about the pain? When did it start, and how would you describe it?
It started about 3 days ago. It's kind of sharp and burning, like someone's poking me with needles. It wasn't too bad at first, but it's been getting worse. The rash appeared a day or so later, and it seems to be spreading.
Right, so, burning pain and a rash that appeared after the pain, that does sound concerning. Given your age and symptoms, one possibility that comes to mind is shingles, or herpes zoster. It's caused by the reactivation of the chickenpox virus, which can remain dormant in your body for years. Does that sound like something you've heard of?
Yes, I've heard of shingles, but I didn't realize it could affect me like this. I had chickenpox when I was a child, so I guess that makes sense.
Exactly. The virus can remain dormant in your nerve cells for many years, and stress, a weakened immune system, or other factors can trigger it to reactivate. The rash you're describing is often localized to one side of the body and follows a specific nerve pathway.
That's exactly what it looks like, just on one side of my ribcage. It's not just the rash, though. The pain is intense. Is there anything I can do to stop it from getting worse?
The pain associated with shingles can be quite severe. There are antiviral medications that can help reduce the severity and duration of the outbreak if started early, ideally within 72 hours of the rash appearing. You'll also want to take pain relievers to manage the discomfort. I'll also prescribe you some antiviral medication today, like acyclovir. It's important that you start it as soon as possible to help speed up your recovery.
Is there anything else I should know about shingles? I've heard it can cause complications.
Yes, shingles can lead to a few complications. The most common one is postherpetic neuralgia, which is persistent pain in the area of the rash that continues even after the rash has healed. This can be particularly troublesome, especially for older adults.
That sounds scary. Is there anything I can do to prevent that from happening?
The antiviral treatment can help reduce the risk of long-term pain, but there's no guarantee. The key is to manage the pain as effectively as possible while the virus is active. I can prescribe a topical cream to soothe the rash and some stronger pain relief medication to help manage the burning sensation. If you're feeling quite uncomfortable, a short course of corticosteroids may help as well.
What about my immune system? I've been a bit run down recently, stress at work and some personal issues. Could that have contributed?
Yes. Stress and a weakened immune system can definitely make you more susceptible to shingles. The virus tends to reactivate when your body is under strain. So it's important to take care of your overall health during this time. If you're finding it difficult to manage stress, I'd recommend speaking with a counselor or therapist to help ease the load.
I didn't realize stress could have such an impact. I'll definitely think about it. What about the rash itself? Is it contagious?
Yes, the rash is contagious, but only to people who have never had chickenpox or who haven't been vaccinated against it. However, it's most contagious while the rash is still blistering. Once the blisters have crusted over, you're no longer contagious. It's best to avoid close contact with people, especially those who are immunocompromised or pregnant, until the rash has healed.
That's helpful to know. I'll make sure to keep my distance from others while I'm contagious.
Good plan. So, just to summarize, I'm going to prescribe you some antiviral medication to start right away. I'll also provide pain relief options and a topical treatment for the rash. If the pain doesn't improve, or if you develop complications like persistent pain after the rash is healed, we'll discuss further treatments.
Thanks, Dr. Jameson. I feel a little better knowing there's a treatment for it.
You're welcome, Anna. I'll check in with you in a few days to see how you're doing. Make sure to rest and stay hydrated while you recover. And if you have any questions, don't hesitate to reach out.
Will do. Thanks again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a training on applying evidence-based practice in nursing. Now read the question.
Today, I am here to introduce a new focus for our nursing staff that will enhance our clinical decision-making process. This focus is on evidence-based practice, which integrates the best available research with clinical expertise and patient values. Our goal is for nurses to utilize evidence-based practice to improve patient outcomes, making our approach both more effective and reliable. By adopting evidence-based practices, we aim to reduce variability in care, making it easier for nurses to make informed choices and for patients to receive consistent, high-quality care. We believe that this approach will lead to increased satisfaction among patients and a stronger foundation for nurses in their day-to-day decision-making.
Now look at question 26. You hear a doctor's discussion with a nurse. Now read the question.
It's a real issue because she seems unaware of the full extent of her condition. She only mentioned taking a small red pill at night, but nothing more specific. She seemed to understand when I explained the importance of the surgery, but
who knows if she actually processed that information or if she'll even remember it once she's stabilized. Do you think her neighbor, who accompanied her here, might help?
I doubt it. He seems concerned and willing to stay, but is just as unaware of her medical history. Honestly, I think we should keep trying to reach her husband for consent.
Now look at question 27. You hear a doctor sharing his view on handovers. Now read the question.
Thank you for giving me the opportunity to share this. When it comes to handovers, providing significant lab results and pending tests is essential to ensure the next shift has the critical information needed for patient care. The process should include relevant lab results and current diagnostics without diving into an overwhelming level of detail. For example, when discussing a patient's condition, it's not necessary to list every lab value from the past week. Instead, focus on key results that directly impact the patient's current treatment plan. Take this case, a patient admitted with severe abdominal pain had an elevated white blood cell count and an urgent CT scan, which is pending. Mentioning that the patient had these results and why the CT scan is significant helps prioritize the handover. The goal is to give an overview that highlights what's most relevant to the patient's condition and the decisions to be made in the near future. Now, as you convey these points, it's important to include any significant trends in lab results, but only if they are pertinent.
Now look at question 28. You hear a surgeon discussing a patient with a nurse in the recovery ward. Now, read the question.
It looks like Mrs. Carter is recovering well after her mastectomy. Will she be going up to the ward shortly?
Yes, I'll arrange for a porter. She should be heading up in about 15 minutes.
Good. I've added a few post-op follow-up notes. It's important we monitor her for any signs of lymphedema. With lymph nodes involved in the procedure, there's always a chance of fluid retention in her arm. We also need to keep an eye on the surgical site for any signs of infection, redness, heat, or discharge. Additionally, don't forget to provide her with resources for emotional support. This can be a tough recovery process mentally as well as physically.
Understood. I'll ensure all these details are passed on to the next shift.
Perfect. If anything comes up or you have any concerns, let me know.
Now look at question 29. You hear a nutritionist talking to a patient. Now read the question. So, what brings you in today?
I'm struggling with digestion issues and feel like I'm always uncomfortable. I know I should be eating more fiber, but I just can't seem to manage it. Maybe fiber just isn't that important?
Well, I'm glad you came to talk about this. Actually, fiber is a crucial part of a healthy diet, especially for digestive health. Many people don't realize that fiber isn't just one thing. It's made up of two main types, soluble and insoluble fiber, and each plays an important role.
Thanks, but I don't know if it's worth all the effort to get more fiber if it doesn't really make a difference.
I understand that, but it's important to know that dietary fiber is essential. Soluble fiber absorbs water and helps soften stools, making digestion easier, while insoluble fiber adds bulk and keeps everything moving. Together, they help maintain a balanced gut and prevent issues like constipation, and even reduce risks of certain diseases. When you lack fiber, your digestive system has to work harder, and that can lead to more discomfort. Now look at question 30. You hear a conversation between a medical ethicist and a healthcare provider discussing the role of religious therapists in patient care. Now read the question.
Spent the past hour reviewing various case studies where patients have requested religious support as part of their treatment plans. I'm trying to determine under what circumstances it's truly beneficial to bring in a religious therapist as opposed to sticking strictly with conventional healthcare providers.
That's an interesting angle. Let me know if I can offer some insights there. I mean, we're already seeing a growing need to accommodate diverse spiritual needs in clinical settings, and it's not always easy to strike a balance between traditional care and spiritual considerations.
Yes, it's definitely a complex balance. Every day, it feels like we're juggling patient needs, ethical principles, and the limitations of our resources.
Absolutely. I have quite a few administrative duties as well, and finding time to integrate religious elements into treatment is often challenging. I do wish there was a clearer process for involving religious therapists in ways that fit within our medical protocols, but
that is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a medical professional giving a detailed presentation on prenatal stress and its impact on fetal development. You now have 90 seconds to read questions.
Welcome everyone, and thank you for joining today's training on prenatal stress and its impact on fetal development and mental health. This topic is essential in maternal and fetal healthcare, because maternal stress during pregnancy can profoundly affect the baby's development. My name is Dr. Olivia Grant. I am a clinical psychologist specializing in perinatal mental health, and I am passionate about educating healthcare providers on recognizing and mitigating the impacts of stress during pregnancy. Joining me today is Dr. Mark Edwards, a registered OB/GYN, who has extensively researched maternal health interventions that promote mental well-being during pregnancy. Dr. Edwards' work focuses on practical approaches that support both maternal and fetal health. As healthcare professionals, we know that the landscape of mental health care is evolving, and it's crucial for us to stay updated with evidence-based practices that might not have been covered in our initial training. This session is a valuable opportunity to deepen our understanding of a topic that continues to grow in significance as new research emerges. The primary objectives for today's session are to discuss the physiological pathways through which maternal stress affects fetal development, review the mental health impacts that may carry into infancy and childhood, and explore practical interventions like mindfulness, exercise, and nutrition that can help mitigate these impacts. We will begin with an overview of the pathways of prenatal stress and its biological impact on fetal development, then break into smaller groups to analyze studies and discuss effective intervention strategies. Let's start by examining how stress in the mother's body affects the fetus. When a pregnant woman experiences stress, her body releases stress hormones like cortisol, which can cross the placenta and enter the fetal environment. Research has shown that high cortisol levels may influence fetal development, particularly brain development, which may increase the risk of behavioral and emotional difficulties later in life. These findings highlight the importance of early intervention to support maternal mental well-being. Another area of study in prenatal stress is its potential link to preterm birth and low birth weight. Stress-induced cortisol has been associated with shorter pregnancies and, in some cases, lower birth weights. These outcomes can have long-term health implications for the child, potentially impacting their cognitive development and immune system functioning. Now, let's talk about interventions. Evidence-based approaches like mindfulness practices, proper nutrition, and regular physical activity have been shown to effectively reduce stress in pregnant women. For example, mindfulness practices such as meditation and breathing exercises can decrease anxiety and improve mental resilience. Nutritional choices, especially increasing intake of omega-3 fatty acids and reducing caffeine, can also help regulate cortisol levels. Finally, moderate exercise has been found to be highly beneficial in managing stress and improving overall well-being during pregnancy. These interventions not only support the mother's mental health, but also help create a more balanced in utero environment for the fetus. In the breakout sessions, we'll look at research articles exploring these interventions in more depth. We'll review studies that detail the benefits of maternal nutrition on fetal brain development, the effects of exercise on maternal cortisol levels, and the positive impact of mindfulness on reducing prenatal stress. Now, I'll turn it over to Dr. Edwards to discuss the specific physiological impacts of maternal stress and strategies for healthcare providers to support expectant mothers.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Linda Cohen discussing cyberbullying. Now, read the questions. You now have 90 seconds to read questions.
Today, we're discussing an issue that has escalated with the rise of technology, cyberbullying, and its impact on teenage mental health. To help us understand more, I'm joined by Dr. Linda Cohen, a psychologist specializing in adolescent mental health and online behavior. Dr. Cohen, thank you for joining us.
Thank you for having me. Cyberbullying is indeed a major issue affecting adolescents, with consequences that can be profound and long-lasting.
To start, could you give us an idea of just how prevalent cyberbullying is among teenagers?
Certainly. Studies show that nearly 1 in 3 teenagers have experienced some form of cyberbullying. The majority of these incidents go unreported, as teens often feel ashamed or fear retaliation. Unlike traditional bullying, which might be confined to school hours, cyberbullying can happen around the clock, making it harder to escape.
That's staggering. And what are the common types of cyberbullying that adolescents experience?
The most common types include harassment through social media, hurtful comments on posts, spreading rumors, and exclusion from online groups or communities. Additionally, there's a growing problem with impersonation, where bullies create fake profiles to tarnish a peer's reputation. It's worth noting that even small, seemingly trivial incidents can have a serious impact if they occur repeatedly.
I can imagine that enduring this type of bullying would take a toll on a teenager's mental health. Could you talk about some of the psychological effects?
Absolutely. Adolescents who experience cyberbullying often suffer from a range of mental health challenges, such as anxiety, depression, low self-esteem, and even suicidal thoughts in severe cases. One of the reasons cyberbullying is so damaging is that it targets an adolescent's sense of self-worth and belonging, which are already fragile during this developmental stage.
That makes sense, especially since teenagers are naturally inclined to seek validation from their peers. Do you think technology itself, like social media platforms, contributes to these mental health struggles?
Without a doubt. While technology can be a positive force, social media creates an environment that encourages constant comparison. Adolescents are comparing their own lives to what they see on these platforms, which can create unrealistic expectations. When cyberbullying is added to the mix, it can amplify these insecurities, making teens feel isolated, inadequate, and even humiliated.
What about the role of schools and parents? What can they do to support teenagers dealing with cyberbullying?
Schools and parents play an essential role in addressing cyberbullying. Schools can implement policies that clearly define and prohibit cyberbullying, and they can establish safe reporting mechanisms. Parents, on the other hand, can maintain open communication with their children. They should encourage teens to talk about any distressing online experiences, reassuring them that it's okay to seek help.
I imagine that prevention is also important. Are there strategies for preventing cyberbullying?
Prevention is crucial. Teaching teens digital etiquette, empathy, and the responsible use of technology can reduce the likelihood of cyberbullying. Schools can provide workshops or training on online conduct, and parents can model positive online behavior. Creating a supportive environment in both school and home settings can help teens feel safe and respected, which can deter bullying behavior.
And if a teen is already a victim, what steps can they take to protect themselves?
Victims of cyberbullying should try to document the incidents by saving messages or screenshots. This can serve as evidence if they choose to report the issue. They should also block or mute the bully to limit exposure and avoid responding to the bullying, as engaging can sometimes escalate the situation. Seeking support, whether from friends, family, or school counselors, is also essential.
It sounds like there are practical steps both teens and their support systems can take to mitigate the effects of cyberbullying. Do you have any final thoughts on the broader impact of cyberbullying on adolescent mental health?
Yes, I'd like to emphasize that cyberbullying not only affects individuals, but also contributes to a broader culture of online hostility. When we see cyberbullying normalized, it can have a cumulative effect, creating a more aggressive digital environment. We need to remember that every individual action matters. Promoting kindness and empathy in all interactions can help build a healthier online world for everyone.
That's a wonderful reminder. Thank you, Dr. Cohen, for shedding light on this important issue and for your practical advice on how we can better support adolescents facing cyberbullying.
Thank you. It's been a pleasure discussing this with you.
That is the end of Part C. You now have 2 minutes to check your answers.